UCareNet's Relief app, developed by William Osler Health System and UCareNet Technologies, delivers virtual care to palliative designated patients, enabling them to self-report symptoms remotely. This benefits both patients and clinicians. Here's how. Patients are able to remain in their home for end-of-life care where they are most comfortable. By self-reporting their symptoms on a daily basis, clinicians can easily monitor, assess, and triage their health status. When a patient reports a change in symptoms or pain threshold, clinicians receive alerts through a real-time, color-coded system, allowing them to respond quickly with the appropriate treatment or intervention. Regular monitoring means no more stressful trips to the ER or unnecessary hospitalization for patients, which in turn means significant savings of healthcare resources and costs. When using UCare Relief, patients have reported an improved quality of life and health equity, feeling empowered to be active participants in their self-care and giving them independence, comfort, and autonomy at home for as long as possible.